Okay, so once again, good afternoon, students. So today we will be discussing on the topic of shock. So what comes to your mind if I say shock? So shock, like we understand or else we get the concept of already like psychologically. It's not like some unexpected things like which is happening. It's not it. So that one is known as psychological one. So we will be focusing mostly on the physical one. Like what are the physical changes that the person feels if a person is having shock. So we will be discussing more on that. Okay. So let's discuss. Okay. So shock, it mostly comes from the word psychological. So in psychologically, what do we say? Psychologically is also known as trauma, or else you can say acute stress disorder. Like if a person is too much scared or else too much stressed, no? So that one is also known as shock. Means in psychologically. But if we will see in the physical one, so what can you see? When there is no proper blood circulation, no proper blood circulation into different parts of your organs, different parts of your body tissues, and all that. So what will happen if there is no proper blood circulation? Obviously, some changes will occur. Okay, some side effects or else some complications will occur. So we will discuss one by one. So causes of shock. In causes of shock, what we will find, it is mostly shock is mostly because of blood flow. Since there is no proper blood circulation, and ultimately it will lead to multiple organ failure. Since there is no proper blood circulation in the different parts of the body, what will happen? There will be no proper blood circulation, and ultimately it will lead to multiple organ failure. Okay, and it is very much what to say, life threatening also. Like it's not good for us also because it mostly lead to death. Like it is not good for us. That is, it takes somebody's life also, since there is no proper blood circulation. Okay, I hope it's clear. Causes. Okay, so next is complications of shock. So what are the complications of shock? What can a person find like difficulty in all? First is shock in the lungs. So which is known as ARDS, acute respiratory distress syndrome. So what will happen here? Your lungs is mostly affected here. Like a person will find difficulty in breathing. Next is acute renal failure. That is a person will find difficulty, not difficulty, sorry, like and there will be changes in renal failure, that is kidney. The person will have some kidney problem. Next is gastrointestinal ulceration. So the person will find difficulty or else will have some problem in the gastrointestine. That is in your digestive system part. The person will find problem in that. Next is dissemination intravascular clotting. So what will happen? Dissemination intravascular clotting, like a person will have problem in the heart also. Like in the heart, there will be clotting. Okay, dissemination means spread. It will spread all over. Next is multiple organ failure. So there will be your organs, no? It will fail. It will fail to function. It will lead to multiple organ failure, and the last one is death. It will lead to death also. Is it clear? Complications? I hope it's clear. Is it clear, Vishal? Vishal Kalita? Is it clear? Next is types of shock. So we will find that Okay. Okay, next is types of shock. So we will find four types of shock, which are hypovolemic shock, then cardiogenic shock, then obstructive shock. Is it clear now? Hypovolemic, cardiogenic, obstructive, distributive. Am I clear now? My voice? Rich person and Vishal, is it clear now? Okay. Next is okay. So next is obstructive shock. So in obstructive shock, what will happen? Your heart will function. Okay, your heart will function normally like how it was functioning before, but there is some abnormalities. You will find some abnormalities. So what is that abnormal thing? What you will find in the outflow? No, this is the outflow from where the blood comes out. That is the oxygenated blood. So from here, what will happen? There is blockage. Since there is blockage, what will happen? The blood won't be able to flow where it is supposed to flow, where it needs to go. Okay, and as a result, what will happen? It will lead to there will be no proper blood circulation, which is the obstructive shock. Next is cardiogenic shock. So this is the cardiogenic shock. So in the cardiogenic shock, what will happen? The heart, it will be like difficult for the heart to pump how much it needs. No, say for example, the normal beats is from 60 to 100 beats per minute, but it won't like pump enough how it was pumping before. Say for example 30, 40, like that. They won't pump enough blood. So this one is known as cardiogenic shock. Next is distributive shock. So this is the distributive shock. So what will happen in the distributive shock? There will be abnormal distribution of blood flow in the blood vessels, which is arteries, capillaries, veins. In all these areas, there will be no proper blood circulation. Okay, inadequate supply of blood means no proper blood circulation. So as a result, what will happen? It won't get enough blood in which areas? In your tissues, your organs, all these areas, they won't get enough blood, which is known as distributive shock. Next is hypovolemic shock. So this is the hypovolemic shock. So hypo means down, okay, low. So since there is severe blood loss as well as fluid and all that, so what will happen? The heart, it won't be able to pump enough blood to your body. Means they won't go and supply enough blood to your body. So ultimately, what will happen? There will be hypovolemic shock. The blood won't be able to give enough what to say blood. It won't be able to go and give enough blood to the different parts of the body. So as a result, what will happen? There will be hypovolemic shock. Next is risk factors. Who are at the risk of having this shock? So first is older age people, means old age people, elderly people. They are most likely to have this shock. Next is heart failure. Whoever are having like heart failure, no? Like the heart is not functioning properly, their heart is not what to say, the heart is not able to pump enough blood. All this kind of heart failure means functioning of heart is not proper, not regular. It's already failing. So all this kind of person, they are most likely to have shock. Next is high blood pressure. Whosoever blood pressure is high, na one more than 160 by 90 beats per minute. Oh, sorry, 160 by 90 mmHg. So all this kind of person, they are most likely to have this shock. Next is diabetes, like high blood sugar level. So all these kind of person, they can have this shock. Okay, next is what are the effects on your body? What are the changes that you can see in a person's body if a person is having shock? First is dizziness, the person's head will go round. Next is drowsiness, same thing, drowsy, like the person will feel weak. Next is irritability, like the person will get irritated very soon in small small things. Anxiety, the person will like have anxiety, the person will have fear. Next is fainting, the person will lose his or her consciousness. Next is enlarged pupils, the pupils will be enlarged, means the pupils will be bigger in size. Next is pulse. So the pulse also will be like very fast. Okay, it will be very very fast. Next is shallow and rapid breathing. Like the person won't be able to breathe very like fluently, like how it was breathing before. It will be very shallow, very deep, and very much fast, rapid breathing. Next is excessive sweating. Like the person will sweat a lot, especially in the armpits or else axilla. Next is nausea or vomiting. So the person will feel like vomiting as well as the person will vomit. Next is blue or gray fingernails or tips. So the person's nails will be bluish in color or else gray. Why? Because the blood, they are not like providing enough blood. So as a result, it will occur in this manner. Next is cold, pale or clammy skin. The person will feel cold and the person's skin will be pale, means poor, very much dull. And clammy skin. Clammy skin means like wet. It will be very wet, sweaty type. Next is hives. This is hives, like skin rash. Okay. Next is first, how can you treat a person like who is having shock? So you can give some treatment which is known as first aid treatment. And what is the name of that? The name of that is cardiopulmonary resuscitation, also known as CPR, or else you can say BLS, which is basic life support. So this is the like mm, treatment that you can give to a person. Okay, so what is the first aid treatment? What you should do? First is in order to confirm whether a person is really conscious, unconscious, you need to confirm. So what do you need to do? You need to shake the person and you need to shout. You need to shout means what? You can call like their name, like hello, Mister, and all that. You can say that. And if a person is like responding, okay, like you can ask him or her to go. But if a person is not responding, even after shouting, even after shaking, so which indicates what? Which indicates that a person is really unconscious. Okay, so as soon as you get confirmed that a person is unconscious, so what you should do, you should call emergency help. It is 108, so you can call them. In the meanwhile, what you can do, you can check for the breathing and you can lift up the chin like this, right? Lift up the chin so that you can check for the breathing and you can check for the carotid pulse or else the vital signs also. And after that, what you need to do, you need to perform CPR, that is cardiopulmonary resuscitation. So what you should do, you should place your hands at the center of the chest, which is this, and you should push hard and fast, about twice per second. You should push like that, one and a two and a three like that. You should do that, and you should repeat that at least 30. Like you should push your hands at least 30 times, and after that, two rescue breaths. Okay, you can wait for a while. After that, again you can perform. So if possible, no, you need some assistant, and that assistant like they can help you because it really needs some physical strength, some physical force. So that's why like you really need somebody's help. Okay, so these are some of the like first aid care or else first aid treatment that you can give a person who's having shock. I hope it's clear, everyone. Tumpe, are you clear? Tumpe Jilan, are you clear? Rashmi, are you clear? Rashmi Sonwal?
Yes, ma'am.
Okay, Rashmi, can you tell me the full form of CPR?
Cardiopulmonary resuscitation.
Cardiopulmonary resuscitation. Okay, BLS? Full form of BLS?
Basic life support.
Okay, very good. Okay, next question goes to Sheetal. Can you hear me, Sheetal? Pinisha, can you hear me? Pinisha Singh.
Ma'am.
Okay, Pinisha, can you tell me the full form of ARDS?
Acute respiratory distress syndrome.
Okay, very good. Okay, what do you mean by hives? Malvina, what kind of disorder is that?
Ma'am, skin rash.
Skin rash, na?
Yes, ma'am.
Okay, so this is it. Okay, hives. So it can occur like this if it is too much severe. Okay, good. Okay, next, Ilashara, can you hear me?
Yes, ma'am.
Okay, Ilashara, can you tell me like if a person is having shock, na, so what are the changes that you can see in a person? Like their nails, their lips and all, what color will it be?
And
Uh-huh.
there is no
Can you
sensation.
please type in the chat box? I can't hear you actually. Okay. Okay, very good. It's correct. So Ilashara, she said the lips will be dark in color and the nails will be gray because there is no proper blood circulation. Okay, the lips will become something like bluish in color. Okay, like dark. It's okay, you can write like this also. Okay, very good. Okay, next question goes to Dibyajit. Dibyajit,
यस मैम
ओके ये शॉक जो है मतलब क्यों होता है? Why it usually occurs? Can you please tell me?
मैम बिकॉज ऑफ इंजरी एंड वे affects the flow of blood.
Affects flow of blood means there won't be enough blood circulation. It's not that there will be inadequate blood circulation.
Yes ma'am.
अच्छी तरह से blood सर्कुलर नहीं करता
Yes
है तो इसकी वजह से शॉक
सर
होता
नहीं होने से
है। हाँ मतलब नॉर्मल ब्लड सर्कुलेशन तो क्या है मतलब पूरी तरह से जाता है ना मतलब सब बॉडी पार्ट्स में जाता है लेकिन शॉक में क्या होगा
यस
मतलब
मैम
पूरा बॉडी में नहीं जाएगा ठीक है मतलब बहुत कम होगा
यस मैम
ठीक है तो इसकी वजह से
यस
मतलब
मैम
शॉक होता है अच्छा ठीक है ओके आई होप एवरीवन इज क्लियर ना
थैंक यू
Okay. Okay, then we will end here. Thank you all for joining. That's all for today's class.